Hello, I'm Matthew Weinstock with Hospitals and Health Networks. As the delivery system moves to a value-driven model, there's a growing need for clinicians to find ways of collaborating and sharing best practices. Since 1990, the Rural Connection has linked nurses across the state of Idaho in an effort to do just that. Through the consortium, nurses from rural, urban, and teaching hospitals meet to share innovations in care delivery and best practices. I'm joined now by Buffie Main, Executive Director of the consortium. Buffie, thanks for being with me.
Thanks for having me.
So can you give me a little bit of history about the consortium? You started about 25 years ago. What's the root of that?
Well, Rural Connection was born out of a Robert Wood Johnson grant. And the original grant was really pretty simple. They were just looking for ways to connect urban and rural when it came to best practice. You have to remember this was in a time before the CAH designation, and so folks were really just looking for a way to communicate. They wrote a grant that gave them the opportunity to benchmark best practice around stroke. And together, several rural hospitals, an urban hospital, and Boise State University wrote a stroke protocol and implemented it across several hospitals, and that's how Rural Connection came to be.
You've evolved since that, right? To now you're part of the St. Luke's system. Tell me a little bit about that evolution.
Sure. Well, about 8 years ago, when CAHs were more firmly designated, the work that we had been doing around benchmarking was kind of picked up by national organizations such as Qualis. So Rural Connection decided to remission and vision and decided to become very specifically focused on nursing leadership and nursing professionalism across the continuum of rural, urban, and academic. One of the things that is really unique about Rural Connection is that conversation, both in the rural-urban back and forth, but also bringing academia into the room, because the future of nursing is so reliant on making sure we have connections with our academic organizations and knowing what we need to do to prepare nursing for the future.
And how many hospitals are involved in the project?
There's 11 hospitals who are part of the consortium, and then Boise State University joins us as well.
And so that conversation that happens between the nurses between the rural, urban, and teaching, what are those like? What are you guys talking about? What are they trying to achieve?
Well, our primary goal is to eventually improve access to patient care as well as patient outcomes. So that's what we're always primarily focused on. For this organization, where we've found synergy or things that we work on together, that tends to be in the realm of continuing to grow the nursing profession through residency programs, preceptor programs, nurse leadership programs, mentorship programs. That's kind of where we found our sweet spot. We have occasionally dabbled in more bedside-related activities, but it becomes so then unique to that setting. We want to make sure that the work that we do goes across the spectrum, rural, urban, academic, and so thus our work gets a little bit more global in nature.
So, Buffy, we've got somewhat of a staffing issue with nursing and the shortage, the role that they're going to play, the expanded role really with health reform and the move to a value-based system. Are there some success stories you've had with the preceptor program or residencies?
Yes, we're really proud of our work around residency and our preceptor program for a couple of reasons. One, both of those programs are rooted in the idea that those experiences are about where you are, rural and urban. And our rural programs have an emphasis on onboarding in the rural community, and that's pretty unique. We blend that all together, and we think that's going to help carry us towards the future. So we've been working really hard to onboard new nurses right now, but the preceptor program is kind of twofold. It helps us onboard a new community of nurses. It's changing a culture of nursing about how we grow the profession, but it's also looking towards the future in that we're taking preceptors, turning them into our leaders of the future. And that's going to be really critical when we think about the role of the advanced practice nurse in the ACO and the new healthcare.
And what relationship does the consortium have to hospital leadership, to the C-suite, if any?
It's really important because as we think about the future of healthcare and interdisciplinary teams, we have to be communicating across all spectrums and to all of our different stakeholders about the value of nursing and how nursing is going to be at the core of healthcare in the future.
And lastly here, what can other states learn from what you've done in Idaho? Is this transferable to other states?
Oh, absolutely. What's so unique about Rural Connection is we've created this non-threatening environment for nurses to come together and talk about how are we going to do this better and how are we going to improve patient care. And we've created an environment where the relationships are our primary component, and from the relationships, the work is an outgrowth that just happens to be fantastic. So it's absolutely transferable. And it starts with nursing leaders who are willing to share information, who are willing to be generative and share their passion and their ardor for nursing. And once you have that kind of leadership willing to work together, then I think anything is possible.
Well, great, Buffy. I appreciate your time today.
Thank you.
For H&HN Daily, I'm Matthew Weinstock.